been a very busy day. I want to thank the American people for the incredible sacrifices that they're making on behalf of our nation. And I want to encourage everyone to keep following our guidelines on social distancing. And I want to encourage everyone to keep following our guidelines on social distancing. And the problem with this one is the contagion. It's so contagious. Nobody's ever seen anything like that. You can be feet away and just talking to somebody and catch it. You can catch it. You know how long it can live on surfaces. So things that nobody even thought of, the level of contagion. You can be feet away and just talking to somebody and catch it.
Hey bitch, you standing on my spot. Get lost. And I'll come back, imbecile. Come here. I don't want to stand next to that bitch anymore.
This video will demonstrate how to correctly put on and take off the required PPE to safely care for a suspect or confirmed COVID-19 patient. Ensure contact and airborne isolation signs are posted outside the room. In addition to standard precautions, you will use airborne and contact isolation with eye protection. Hand sanitizer, isolation gown, gloves, PAPR, biohazard can, and transport container for PAPR. Set up the biohazard trash can and PAPR transport container outside the room. Prepare to enter the room. Clean your hands. Put on gloves. Put on isolation gown. Check battery on PAPR and attach PAPR to waist. Attach hose to PAPR hood. Put on PAPR hood and turn PAPR on. Ensure all equipment is comfortable before entering room. Enter room and close door. When you're ready to leave the room, remember that the front of your equipment is considered dirty while the back is clean. Do not touch the front of your gown, face shield, or PAPR hood. Remove gloves and clean hands. Leave room and close door. Put on clean gloves. Disconnect PAPR. Remove PAPR hood and place in biohazard trash. Remove PAPR and place in designated transport container. Remove gown. Grasp the front of the gown and pull away from the body so that the ties break, touching outside of gown only with gloved hands. Roll the glove inside out into a bundle. Removing the gloves with the gown. Discard gown and gloves and clean hands.
This is something that has actually unified us. Because we're all going through the same things together.
Prepare to enter the room. Clean your hands. Verify that you have all the needed supplies. Put on gloves. In addition to standard precautions, you will use airborne and contact isolation with eye protection. Ensure all equipment is comfortable before entering room. Enter room and close door.
Because of COVID-19,
Many people died in my hospital. And I was the cause of it. Because I don't give a shit about protocols. No gloves and no hand washing before you enter the room. Not correct dressed according to the protocols. Entering the room without eye protection. And without gloves, of course.
Clean your hands. Put on gloves. When you're ready to leave the room, remember that the front of your equipment is considered dirty while the back is clean. Do not touch the front of your gown, face shield, or PAPR hood. Remove gloves and clean hands. Leave room and close door. Remove gown. Grasp the front of the gown and pull away from the body so that the ties break, touching outside of gown only with gloved hands. Roll the glove inside out into a bundle. Removing the gloves with the gown. Discard gown and gloves and clean hands.
Thankfully, with these disposable ones, they just rip off. So you want to give yourself a hug, and you pull up the shoulders, and you're going to be basically pulling off at the shoulders and waist, and you're keeping your hands in those sleeves, and you roll this gown off of your hands down to the gloves and remove the entire thing, including your gloves, with it as a whole entity. Ball it up and throw it in the trash.
Set up the biohazard trash can and PAPR transport container outside the room.
Again, you did everything wrong. Let's see where your germs hands go now. That is some handy place for your sanitizer. Leaning with your germ arms all over the equipment here.
a battlefield, and we've turned ourselves from nurses into soldiers.
Let's see what the CDC say about this. Using personal protective equipment, PPE. Put on isolation gown. And first use hand sanitizer. Well, this nurse didn't do that. And then she put on her gown in an improper way. Put on a face shield or goggles. She didn't do that. Perform hand hygiene before putting on gloves. She didn't do that. She didn't wear gloves. How to take off Dove PPE gear. Remove gloves. She didn't do that. Remove gown. Do it in a gentle manner, avoiding a forceful movement. She ignored all that. We just seen how this actor doctor put on his gown and equipment. So you must dispose it in the room.
Set up the biohazard trash can and PAPR transport container outside the room.
Placing those containers outside the room is not what the CDC is saying. So that is wrong. So and then you can leave the room and perform hand hygiene and then remove a face shield or goggles. This is a case for health inspection. This hospital and nurse are responsible for many infections. And if we have to believe the news, many deaths.
We all took an oath and we all have a responsibility to our patients.
Since when is breaking all protocols and spreading germs around a responsibility for your patients, idiot?
This is what we were born to do. So even if it's a little scary,
Yeah, I think it's pretty scary. The way you're breaking the protocols. You are the cause of all those infections in this hospital.
this is something that has actually unified us.
You are responsible. We should make a citizen arrest and arrest you. Daffy Duck.
Leave room and close door. Put on clean gloves. Disconnect PAPR. Remove PAPR hood and place in biohazard trash. Remove PAPR and place in designated transport container.
This is something that has actually unified us. We have changed our visiting policy to not allowing most visitors. It was a very difficult decision to make, but it's a decision that was necessary to keep our patients safe.
Written instructions for how to put on and take off PPE, along with up-to-date COVID-19 information, is available on eSource. If you have any questions or concerns about COVID-19, please contact your facility infection prevention practitioner. Remove PAPR and place in designated transport container.
It seems this instructional video is a little bit wrong. Because we should place the disposal containers inside the room with the patient and remove our gown in the room with the patient. But that's also a little bit weird, because according to science, coronavirus can linger in the air for 3 hours and stay alive for 9 days. Those rooms should have double doors with a negative pressure and never open 2 doors.